One of the other common objections to gummy bear implants is that they can rotate. It's true, they can. It's a whole new kind of risk that doesn't exist at all with a round implant. If a round implant turns in the body, well, it's round and it looks the same. But the teardrop implant, whether it's taller than it is wide or some that are wider than they are tall, if they turn, they look different. And if you look at them in profile, if they turn sideways, they create a distortion. So if properly oriented, this orientation becomes a cosmetic benefit. But if the orientation is lost, it becomes a liability. Well, so what's the data show? The data shows that rotation exists. It does happen, but it's extremely uncommon. I think that if these implants are used in which there's a relatively tight breast and the implant is sized appropriately, though the rate of this doesn't approach zero, it's extremely low. The way to avoid the rotation is not to use this implant in a big, loose, empty, floppy breast, because then the breast tissue can't help hold this in place. And it's important to use a size of an implant that's large enough to fill up the breast to also help minimize rotation. But even taking rotation into account, if you add up this entirely new category of risks, rotation, and you add it to capsular contracture, other types of implant malpositions, implant rupture, you list all the complications with this implant, and then you list all the complications with this implant, the studies still show that this has a lower rate of complications. So, while again it's true that there's a new category of risk in rotation here, if you add that to capsular contracture and all the other problems, there's still less problems with this implant than there are with this implant. Still, in a practical sense, sometimes I'll be consulting with a patient and they'll understand all of that, but they'll say that they still want to use the round implant because they simply don't want to have to worry about that risk. No surgeon can warranty against an implant rotating. I tell a patient that if the implant rotates, then they'll need another surgery at their expense to replace it with a round implant. This is extremely rare, and the only times I've had this happen so far have been in patients in which they had a large, loose, relatively empty breast in which we probably put in too small of an implant. So again, this risk can happen, but it's a very infrequent occurrence. And again, if you add this risk to all the other risks, it still is a lower total set of risks than with the regular implant. I hope that helps to settle this issue about implant rotation.